All right, let's kick off this deep dive. And, we're focusing on the U.S. healthcare system today. And, as nursing students, this is something that's, very important, something you're going to be dealing with throughout your career. And we've got a ton of sources here that we've been digging through.
And it's interesting because right off the bat, we run into this question, like, is healthcare our right? Is it like having clean water, something everybody should have access to?
Yeah.
Or is it more like owning a car? If you can afford it, great. If you can't, well, tough luck. And, this debate really underpins so much of, the discussions around healthcare in the U.S.
Yeah. And as future nurses, you're going to be right there. You're going to be the ones dealing with the challenges. And, one of the things that we've got in our sources, they talk about the Institute of Medicine.
Right.
They're really calling for a better system.
Right. They laid out 6 aims for an ideal healthcare system. Safety, effectiveness, efficiency, patient-centered care, timeliness, and equity. And, you as future nurses, think about it. Every shift, you're going to encounter these.
Right.
Making sure a patient gets the right medication, that's safety.
Right.
Providing emotional support alongside treatment, that's patient-centered care. Every action you take, every decision ties back to these goals.
It's kind of a lot of pressure, huh?
It is. And these goals actually paved the way for initiatives like the Triple Aim, later expanded to the Quadruple Aim.
Okay.
Which focuses on enhancing patient care, improving population health, reducing costs, and crucially, improving the well-being of the healthcare workforce.
Wow.
Because, they recognize a burnt-out, stressed care team can't deliver quality care.
Right.
And that's especially important, for you guys entering this field. It's very demanding.
And that really hit home in one of our sources. It features a nursing student, just like you, named Julia Strobel.
Oh, interesting.
And she's faced with a tough situation. She's got this young girl, and the girl has strep throat.
Mm-hmm.
And the mom, Maritza Cortez, she can't afford the antibiotics. So it's kind of an ethical dilemma, but it's also a practical challenge, right?
Absolutely.
Like, what do you do as the nurse in that situation?
This scenario forces us to confront, the realities of healthcare access and affordability in the U.S. And as future nurses, you're going to have to think critically. You're going to have to advocate for your patients, and you're going to have to work collaboratively within a system that doesn't always make things easy.
No, it certainly doesn't. One of our sources points out that the COVID-19 pandemic, it really exposed just how deep health disparities run in our country.
Right.
The pandemic's impact, it wasn't felt equally. Certain communities got hit a lot harder, and it really revealed the need to address these inequalities.
Right. And this whole issue of access is deeply intertwined with affordability and the availability of services. Now, the Affordable Care Act, the ACA, it was a major step towards expanding coverage. But high insurance costs remain a significant barrier for many.
Yeah, the ACA, that's a great example of how policy impacts your work as nurses. Because before the ACA, you might have encountered more uninsured patients navigating a really complex and confusing system.
Oh, absolutely.
And now, with expanded coverage, you're more likely to encounter patients with insurance. But they might be struggling to understand their plans. What's their deductible? What's their copay? So your role becomes not just about giving care. It's about helping patients navigate these complexities.
Yeah, you become like an advocate.
Exactly, yeah.
And, even with the ACA's progress, the number of uninsured Americans is actually rising again. During those early months of the pandemic, over 5 million people lost their health insurance. They lost their jobs. And it really highlights the fragility of our system.
Yeah, it's mind-boggling. Even when the economy was doing well, that uninsured rate was creeping back up. So, healthcare access in the U.S., it's constantly in flux, and you'll have to stay informed about these changes to, best support your patients.
Right. Always stay up to date. And on top of that, we have a growing provider shortage, particularly in primary care. With our rapidly aging population, they need more care. And we don't have enough doctors entering primary care. Access becomes even more challenging.
It's like we're always playing catch-up. More people need care, but fewer providers to give it. What's the solution?
Well, some experts, like Nurse Linda Aiken, she advocates for a greater role for nurse practitioners.
Yeah.
They can provide many primary care services, increasing access, especially in areas that are underserved. So imagine you, as future nurses, you could be part of this solution, taking on these expanded roles and filling those gaps in primary care.
That'd be amazing.
Yep.
But it also makes you think about the challenges, right?
Oh, absolutely.
Because expanding the scope of practice for nurses, that would require changes in regulations, changes in education. It's a reminder that, even when we have solutions, putting them into practice in our complex system is rarely straightforward.
Yeah, it's never easy. And speaking of challenges, our next source tackles a pretty sobering issue: quality and safety within the U.S. healthcare system.
Cool, let's dive into that.
There was this landmark report from the Institute of Medicine. It was called "To Err is Human."
Okay.
And it revealed something startling, Preventable medical errors, they're actually a leading cause of death in the U.S. Like, thousands of patients die every year from mistakes that could have been avoided.
That's a pretty heavy statistic.
It is.
And, as future nurses, that really emphasizes, the weight of the responsibility.
Oh, yeah.
Knowing that even small errors can have huge consequences, it's a reminder of how important it is to be vigilant and pay attention to detail.
Absolutely. And one of the major contributors to these errors is how fragmented our healthcare system is. Information gets lost between different providers, different settings, communication breaks down, and patients can fall through the cracks.
So how do we improve a fragmented system like that?
Well, the Institute of Medicine recommended a 4-tiered approach. Okay. First, establish national focus on safety. Second, implement systems where we can learn from errors. Third, raise those performance standards. And finally, create safety systems within healthcare organizations. It's about creating a culture of safety, at every single level.
Yeah, it makes you think about, all those checks and balances we have in nursing school.
Yeah.
All that emphasis on following protocols and procedures.
Right.
It's not just about learning the skills. It's about, building those safety habits right from the start.
Yeah, absolutely. And alongside safety, there's this growing focus on the quality of care. And it's not just about avoiding errors, it's about delivering the right care to the right patient at the right time. And we're seeing a shift towards pay-for-performance models.
Pay for performance. That sounds interesting. What does that mean?
So basically, it means tying reimbursement to quality outcomes. So you're rewarding providers for better, more efficient care rather than just the volume of services. It's a move towards value-based care, focusing on those outcomes and patient well-being.
Okay, so instead of just focusing on how many patients we see, we're being incentivized to make sure those patients are actually getting better, getting the right care. It's a subtle but important shift in how we think about healthcare.
Precisely. And there are specific programs, designed to measure and reward this value-based care, like the Hospital Value-Based Purchasing Program and HEDIS. That's the Healthcare Effectiveness Data and Information Set. And these programs track performance on all sorts of measures, incentivizing hospitals and providers to prioritize quality improvement.
And we can't forget about the HCA HPS survey, right?
Oh, right.
That's where patients get to rate their experience.
Exactly.
Everything from communication with nurses to pain management, and that feedback, it impacts the hospital's star rating, which, as you can imagine, has a big impact on their reputation.
Absolutely. It even affects their reimbursement.
Wow.
And on top of that, hospitals face penalties for too many readmissions.
Oh, wow.
Which really pushes them to focus on care coordination, making sure patients have the resources and support they need after their discharge so they don't end up back in the hospital unnecessarily.
So it seems like all these initiatives, pay for performance, patient satisfaction surveys, readmission penalties, they're all pushing towards a more patient-centered, outcome-oriented approach.
Exactly.
And as future nurses, we need to keep these things in mind because they'll directly impact our work environment.
Absolutely. And you know what? There's a significant shift happening in where care is actually delivered. We're moving away from this hospital-centric model and towards a more community-based approach.
That reminds me of when I was doing my clinical rotations, I saw how limited hospital-based care can be. We had this patient, she was ready to be discharged, but she didn't have the right support at home.
Oh, yeah.
And it made me realize, quality care isn't just about what happens in the hospital. It's about what happens when they leave, too, making sure they have what they need.
That's a really important point. And it speaks to the importance of care coordination. Deliberately organizing patient care activities between everyone involved so we ensure a smooth transition between settings and providers.
So care coordination is all about communication and collaboration.
Exactly. It's about making sure everyone, the doctors, the nurses, the therapists, and most importantly, the patient, that they're all on the same page, working together. And as future nurses, you'll play a key role in this. Well, think about it. You're the ones who spend the most time with patients. You're gathering information, monitoring their progress, advocating for their needs. You can really bridge those gaps between different providers and settings, making sure the patient has a smooth experience.
I like that, bridging the gaps. It's like we're building connections, creating a network of support around each patient.
Exactly. It's a holistic and coordinated approach to care.
And that holistic approach, it becomes even more important as we move away from hospitals and towards community-based settings, right?
Exactly, like primary care clinics, home health agencies, long-term care facilities.
So we've talked about this shift towards community-based care.
Yeah.
What are the challenges and opportunities for us as future nurses?
Well, on the one hand, it's pretty exciting to think about all the roles nurses can play in these settings. You could be providing primary care in underserved communities, managing chronic conditions in patients' homes, coordinating care for older adults in long-term care.
It sounds like these settings give you more autonomy, a chance to really make a difference. But what about the challenges?
Well, one of the biggest is ensuring quality and safety when care is delivered outside the hospital. You might have less access to resources, technology, support staff.
Yeah, that makes sense. You'd need to be more resourceful, independent, comfortable making decisions on your own. It takes a different skill set.
You're right. You also need to be really good at working with patients and their families, empowering them to take an active role in their own care.
So that patient-centered approach, it becomes even more critical in these settings.
Exactly. It's about moving away from doing to patients and moving towards doing with patients. It's a partnership.
And this brings us back to Julia Strobel and Maritza Cortez.
Right.
Imagine if Maritza had access to a nurse practitioner in her community, someone who could offer guidance, resources, maybe even different treatment options. It shows how community-based care can address those gaps in access and affordability we talked about.
You've hit on a crucial point. Community-based care isn't just about convenience. It's about reaching those who might otherwise fall through the cracks, meeting them where they are.
It sounds challenging but rewarding.
It is. And as you explore your options, remember, healthcare settings are evolving. We're seeing urgent care centers, ambulatory surgery centers, even telehealth services. These offer convenience, accessibility, and often lower costs.
It's amazing how technology is changing how we deliver care. We can connect with patients remotely, monitor their vital signs, do virtual visits. It's a really exciting time to be entering nursing.
It is. But amidst all this innovation, we can't lose sight of the human element of care. Technology is a tool. It can never replace the compassion, the empathy, the critical thinking that nurses bring.
Well said. And that human element, it becomes even more important when we think about the cost of healthcare.
That's right. We can't talk about healthcare delivery without addressing the elephant in the room. Care financing. Right, healthcare financing, it's a big one. In the U.S., we've got this multi-payer system. Yeah, it means we have a mix of everything. Private insurance, government programs like Medicare and Medicaid, and then people paying out of pocket.
So many different ways to pay.
Exactly. It's different from a lot of other developed countries. They have what's called a single-payer system, where the government basically covers everyone.
That sounds a lot simpler.
It can be. Our system can be confusing, and there's a lot of inefficiency.
I bet. For both patients and providers.
Absolutely. Patients have a hard time figuring out this web of payers, and for providers, it's a huge administrative burden, all the billing and reimbursement stuff. And it all adds to the high cost of healthcare. A lot of money gets spent just processing payments.
So even though the Affordable Care Act helped expand coverage, we still struggle with the cost of healthcare.
Exactly. Even with help from subsidies and Medicaid, a lot of people still struggle to afford their premiums, deductibles, and copays. It's a major barrier to getting care, and it's something you, as future nurses, need to be aware of.
You're right. It's sad to think people might put off care because they can't afford it. We need to be understanding and advocate for solutions.
I agree. And speaking of advocating for change, it brings us to the debate about healthcare reform. It's a complex with a lot of different viewpoints.
What are some of the main issues at play?
Well, one of the biggest is how to control costs without sacrificing quality. And then there's access. How do we make sure everyone can get affordable, high-quality care no matter their income or job?
Big questions. No easy answers.
Right. It's a balancing act, and you'll be working within the system. Your voices and perspectives are important in shaping its future.
So how can we, as nursing students, even begin to get involved?
Stay informed. Read about healthcare policy, follow the news, talk to your classmates, professors, and colleagues. The more you understand this complex system, the better you can advocate for positive change.
It's exciting to think we can be part of something bigger than ourselves.
You absolutely can. As you continue your education and start your careers, remember healthcare is always changing. New models of care, new technologies, and the debate about reform continues. Stay curious, keep learning, and be open to new ideas because the future of healthcare depends on nurses like you.
It's daunting but also exciting to think about all the challenges and opportunities ahead. This deep dive has made me feel more prepared and ready to make a positive impact. Thanks for the insightful conversation.
It was my pleasure. Remember, you have the potential to be incredible agents of change. Embrace the challenges, keep learning, and advocate for your patients and a more equitable healthcare system.
Thank you all for joining us on this deep dive into the U.S. healthcare system. We hope this exploration was helpful as you continue your journey toward becoming nurses. Remember, it's a challenging but rewarding profession. You have the power to make a difference, so keep learning, keep asking questions, and never stop advocating for what you believe in. We'll see you on our next deep dive.